All right, you guys, for some of you who might be really working on your booty for your New Year's resolutions, getting a nice, high, tight booty.
But it's just not happening.
But it's just not happening. Weird. We have amazing options for you here at Good Things Utah. We're so excited to have Roxanne here from Trilogy Med Center out in Midvale. You're talking about Brazilian butt lifts.
We are, yeah, non-surgical Brazilian butt lifts.
Non-surgical.
There has been a huge request and demand for non-surgical gluteal augmentation. And
wait, what are we calling it?
So it's a non-surgical gluteal augmentation.
So is this making it fuller or actually lifting? Or both?
It's doing both. How it works is it's a semi-permanent filler that it's called Sculptra. We actually mix it with PRP, which is platelet-rich plasma. I don't know if you guys have heard of that, but we draw your blood, spin it out, and separate the growth factors.
Well, a lot of buzz about that in the last couple of years used to rejuvenate your skin.
That's right, yeah. We actually microneedle Sculptra and PRP. We mix it together and microneedle it into the skin, and it is unbelievable. The results have been fantastic.
Wow.
So we use PRP a lot in our practice, but you know, for the purpose of gluteal augmentation, we mix them together and inject them in each side of the glutes, the lateral and upper part of the glutes, to create volume and lift the bum.
So this is temporary. It's not going to last forever, right?
No, but it has a duration of about 2 to 3 years.
Oh, wow.
Yeah, and we've seen a small percentage of patients that it's lasted, you know, up to 4.
Oh, you're kidding.
Who would be a good candidate? Someone who's worked out
Me.
a lot, but they're frustrated.
Yes, exactly.
They're frustrated that they can't target that area, that it's
right.
not. I mean, is it because it's too flat, or maybe like you have a
Anatomy,
sag?
genetics. The ideal candidate has a BMI of 20 or less, or someone who's at their ideal body weight. You know, if you have a BMI of over 20, 21, you're really looking at more of a fat transfer because you won't see much volume because Sculptra creates volume by stimulating your body to produce its own collagen. So really you have to be at your ideal body weight or less.
Okay, so say you go in, you get the procedure done, like can you not sit down for a while?
No,
What's the recovery
There is
like?
absolutely no downtime, which is why we have seen such a huge increase of patients that want this done. With traditional surgical Brazilian butt lifts, you cannot sit for up to a month.
Wait, what?
Yes.
I did not even think of that question, but you're right. That's
Not
pretty
sitting.
pertinent.
Yeah. Yeah, and with this, you can walk out of the clinic, you can go exercise, you can go back to work.
Wow.
You can, yeah.
Roxanne, are you injecting on the top or the side or underneath?
Yeah, great question. We actually stay away from the bottom of the glutes because you don't want to create heaviness and sag.
Yep.
And depending on each patient, it's very specific, the lateral or upper half of the glutes to create lift and that little bit of a shelf.
What are you hearing from patients who've tried this?
Oh my gosh, the response has been incredible. We have seen patients that have never been able to build their glutes with exercise or just simply because they've always had a flat bottom that now can fit into jeans, fit into pants, and love the way it looks. It's not your Kim Kardashian booty.
That's what I was going to ask you.
That's more of a surgical thing, right?
Exactly. That's
going under the knife.
That's right. That's either a fat transfer or implants. So it's not going to give you that, but it's going to give you volume and lift. A fullness. That's very natural looking, not like a booty.
I feel like I have so many more questions and we're out of time. If you have questions
where
too,
do I sign?
Trilogy Medical Center is where you get answers. Their address right there on your screen along with their phone number located in Midvale. Give them a call. They can talk you through this. Roxanne, thank you so much.
Thank you. Thank you for having me. I appreciate it.
We're headed to the kitchen.
Yeah,
do you know what we're making?
I do.
Emily Gibson has been talking about these cookies for I don't know how long, and now she's sharing her famous chocolate chip cookie recipe.
Look so good. You guys have to stick around.